Hi, my name is Bree Herring, and I'm going to do my presentation over an article that discusses predictors and prevalence of post-concussion depression symptoms in collegiate athletes. The objective of this study was to describe further mental health problems that athletes face. The two groups included those that reported no concussions within the past year and those who had suffered concussions within the past year. The examination baseline for predictors for post-concussive depressive symptoms, also known as PCDS. The two groups were divided into patients, which were the athletes, and participants, which was the control group. There were 84 collegiate athletes as the patients and 42 individuals as the participants. The patients had concussion histories. 65 were men and 21 of women. And for the control group, they had no concussion history, which was 25 of men and 21 of women. The NCAA sponsored the study. 43% of participants were examined 48 hours after getting a concussion, and 71% were examined 5 days after getting a concussion. The BDIFS was performed at the baseline and after as a post-concussion examination. Various exams were used during this study, such as the BDIFS, PHIQ, WTAR, and PCSS. All these examine mental health or mental illness as well as concussions. The results from these exams were analyzed to see if any of the information was related. This included the demographics, sports information, concussion history, as well as the results. A statistical analysis was performed on depression symptoms as well as the groups. The depression symptoms went from the baseline and increased to post-concussion, and the groups went from high to low in terms of their depression symptoms. This was based on the BDIFS. A follow-up analysis was performed for predictors of PCDS, in which history of psychiatric treatment was controlled for. The results showed that 20% of athletes had an increase in depression, whereas only 5% of the control group had an increase in depression. And athletes also had an increase in clinically important depression post-concussion symptoms. The results from the baseline concussion symptoms test indicate that premorbid intelligence and the age of first participation in the sport are key factors in the results. The control group indicated that there were depressive symptoms, as well as a number of previous head injuries and baseline depressive symptoms were also key factors. In conclusion, a large number of athletes showed increased depression after having had a concussion. These were based off the baseline predictors which were identified in the tests. However, more research is needed in order to understand why specific athletes have an increase in PCDS, as well as how concussions can better be predicted as well as prevented. In the experiment, 22 participants had missing data but were kept as a part of the study. If I were to repeat this experiment, I would get rid of any potential confounding factors, including this 26% of the surveyed individuals. This was my reference for this presentation.